We begin our arthroscopy of the shoulder with the arthroscope in the posterior portal. We'll then start with a diagnostic arthroscopy, and we can begin to see some fraying of the posterior labrum. We'll go ahead and we'll establish our anterior portal and introduce our probe, and we can begin to see the nature of the injury to the posterior labrum. We'll finish our evaluation by switching the arthroscope to the anterior portal with our probe in the posterior portal. Next, we'll then introduce our shaver, and we're going to begin our repair by preparing the bony bed. We'll finish our bony bed preparation with the shaver in the posterior portal. Once we're satisfied with preparation, we'll then start with our repair, and for this particular suture we'll be utilizing a crescent-shaped suture passer. We'll pass a PDS suture just off of the articular surface of the glenoid. Once we've passed our PDS suture through the labrum, we'll then withdraw it through our green cannula, and we'll then tie our labral tape to our PDS suture. We'll then be using the PDS suture to pass the labral tape through the labrum, and we'll also be using a grasper here in an effort to reduce the risk of cutting through the labrum with our labral tape. Once we've completed shuttling of the labral tape, we'll then start with drilling. We'll be making sure that the tension of our repair is appropriate just as we seat the anchor, but prior to malleting the anchor in. Here we're inserting our anchor, and now we're assessing our appropriate tension, and then now we're malleting our anchor in. We'll then cut our suture flush with the surface of the glenoid. We can then proceed with our second anchor, and utilizing similar technique and suture passer, we'll introduce our PDS suture and then withdraw it through our cannula and proceed with similar drilling and anchor placement. We then proceed with a third anchor, utilizing again similar technique. Finally, placing our fourth and last anchor, utilizing the same technique. With our repair completed, we can then start with our arthroscope in the posterior portal, and with our probe we can see the tension of our repair. Then switching with our arthroscope to the anterior portal, we can see the remainder of our repair.